Selecting a DNP program represents a commitment to the highest level of clinical nursing education. When comparing a DNP Nurse Practitioner program to a traditional MSN program, my understanding is that a DNP program has a stronger emphasis on clinical expertise, leadership, and systems level impact. A DNP program focuses on organizational and population level change, equipping nurses with the necessary skills required to identify, develop, and evaluate practice change initiatives that improve both individual and population health. Additionally, DNP-prepared nurses are trained to critically analyze health policy to influence, develop, and implement healthcare reform, ultimately impacting healthcare delivery beyond the bedside by addressing systemic barriers and promoting equitable, high-quality care. In my current nursing role, I have had the privilege of working closely with individuals and families across diverse backgrounds, which has reinforced my love for helping people and my commitment to providing compassionate, patient-centered care. Through these experiences, I have witnessed firsthand how access to quality healthcare within the community can profoundly impact health outcomes and overall well-being. I care for patients with both complex acute and chronic conditions and have frequently encountered situations where early intervention, patient education, and preventative care could have significantly altered patient outcomes. While I advocate for my patients and collaborate closely with interdisciplinary team members, I have experienced the frustration of reaching the limits of my scope of practice, particularly when I see how social determinants of health and systemic inequities prevent patients from achieving lasting wellness. These experiences have solidified my commitment to becoming an FNP who bridges the gap between acute care and long-term wellness by leading initiatives that promote health equity. I participate in Mission Hospital's quality improvement initiatives as a member of the Healthcare Acquired Pressure Injury Committee. Through quarterly hospital-wide audits and direct patient assessments, I have gained a deeper understanding of how evidence-based interventions and system-level changes can significantly improve patient safety and outcomes. Actively contributing to these initiatives has strengthened my interest in the DNP role, as I have seen how research, clinical expertise, and leadership intersect to enhance healthcare delivery. My public health degree has played a significant role in preparing me to become an FNP, as it has shaped my understanding of health beyond the clinical setting. I am deeply passionate about providing equitable care to underserved and vulnerable communities, addressing the social determinants of health that contribute to health disparities. Public health has broadened my perspective beyond individual patient encounters, allowing me to better understand how extrinsic factors influence both individual and population health outcomes. My role as a nurse educator has strengthened my ability to teach, mentor, and effectively communicate complex health concepts, skills that will enhance my practice as an FNP in providing patient-centered care and health education to diverse populations. In both my nurse educator role and my experience as a trauma nurse, I have developed strong communication skills and the ability to establish trusting relationships with individuals from varied backgrounds. These qualities align with the core competencies and professional values of a DNP-prepared FNP. I pride myself in being a lifelong learner as healthcare is constantly evolving. I view lifelong learning as a responsibility to my patients and my profession. I actively reflect on clinical experiences, seek feedback from interdisciplinary colleagues, and remain open to refining my practice as new evidence emerges. This commitment to continuous growth has prepared me for the rigor of doctoral education and for the advanced responsibilities of the DNP-FNP role. Earning a master's degree in nursing education while working full-time was a long-term goal I successfully completed last May. To achieve this goal, I developed a structured plan that balanced my academic responsibilities with my demanding work schedule. This included setting weekly study goals and utilizing days off efficiently. Time management and self-discipline were critical components of my process as courses were rigorous. One of the greatest obstacles I encountered was the physical and mental fatigue associated with working night shift full-time while completing graduate-level coursework. Adjusting my sleep schedule, managing stress, and preventing burnout required intentional effort. I also learned to remain flexible and resilient, adapting my study strategies when work demands increased. This experience strengthened my perseverance, adaptability, and ability to manage competing priorities, skills that are essential for advanced practice nursing. Thanks.